Once a child develops hepatitis A infection or jaundice, there's a lot of morbidity associated with it. There is jaundice, there is lack of appetite, there is lethargy, the child is not able to go to school, and this infection is not for a few days. It takes weeks for the liver to recover. Hi, this is Dr. Neelam Mohan, Senior Director and Head of Department of Pediatric Gastroenterology, Hepatology and Liver Transplantation at Medanta, the Medicity, Gurugram. Hepatitis A is the commonest cause of jaundice in children in India. It is acquired through contaminated food and water. Initially, India was in a highly endemic zone where subclinical infections were more often seen in children and they would not develop serious disease. But now, as India is moving towards an intermediate endemicity, more and more infections are acquired in older children, adolescents, and even adults. Why are we still seeing all these infections despite a vaccine being available? So, one, these infections are due to contaminated food and water, and though we are trying to improve the sanitary conditions, etc., we still in India see a lot of these infections, not only in the lower and middle class, but also in the upper class. Once a child develops hepatitis A infection or jaundice, there's a lot of morbidity associated with it. There is jaundice, there is lack of appetite, there is lethargy, the child is not able to go to school, and this infection is not for a few days. It takes weeks for the liver to recover. And if I say an average, it is at least a month, if not few weeks more. In majority of the conditions, they improve in 4 to 8 weeks and occasionally can take as long as 3 months to 6 months in rare situations. 20% of these children can develop problems like cholestasis jaundice, which means deep jaundice and itching, or relapsing jaundice, and certain issues related to the infection like pancreatitis, bone marrow depression, anemia, etc. But what is the most dreaded complication? Besides whatever the school laws, the time laws, the parents are also saying with the child. So the time that is lost by the work time by the parents, their leaves, the child leave, all this even if you put aside, it's the mortality. What do I mean by that? Is hepatitis A infection is the commonest cause of liver failure in children in India. The smaller the child, less the chances of liver failure. But in an adolescent or an adult, the incidence of liver failure is as high as 1 in 100 infection. What happens in liver failure? In liver failure, the patient's blood starts poor clotting, so there is bleeding tendency. There is there is edema, so the child gets more irritable and gets into an encephalopathy state. Encephalopathy is where there is a swelling of your brain because of toxins which get into the brain. The liver is not working, so the toxins are not out of the body, and so they get into the brain and there is a swelling which we call as hepatic encephalopathy, cerebral edema. That is the most dreaded complications, and sadly, it is said that once these children develop liver failure, 65% of them on an average cannot be salvaged without an excellent medical management. We at Medanta, the Medicity, reviewed our children who came to us with liver failure in the last 8 to 10 years. And what we saw that out of the 360 liver failures that we came across, 170 such children were due to hepatitis A infection. And in these children, because of an excellent management, 70% plus we could salvage by medical management, and the rest needed a liver transplant to save their lives. What about those hundreds of children who develop hepatitis A infection and cannot access good tertiary medical care? In terms of management, we would lose these children. So while there is an hepatitis A vaccine which is available in our country for more than a couple of decades, we are still not using this vaccine very often in our children. The reason is this vaccine is expensive and it is not in the universal immunization program. What have we learned from the universal immunization program? Universal immunization program means the government adopts this vaccine in the vaccine protocol for all children in the country. So one, we adopted rotavirus in vaccine, and with that there has been a tremendous decrease in the incidence of severe acute watery diarrhea and diarrhea associated deaths that we were seeing in our country. Similarly, pneumonia was one of the commonest cause of infectious deaths in children in India. So the government has adopted the pneumococcal vaccine in the universal immunization program. This is a good step to reduce it. So I think it is time for government to consider adopting hepatitis A vaccine also in the universal immunization program. And when we encourage the indigenously produced companies like we did in the other scenarios, now we do have indigenously produced hepatitis A vaccine recently available in the country. And if the government communicates with this vaccine producers, we can cut down the cost significantly so that the government is able to put it in the universal immunization program. Though there are various agencies, international available, which like to support for vaccines, but India usually does not accept, as we've seen even during the COVID time and in other scenarios. India refuses to take help for vaccines from international agencies. We believe in made in India and scenario, and I'm sure we can do it in India. That. So, dear friends, this was an eye-opening message that I wanted to give, that in the last almost 5 to 6 years, our data, we showed 1,000 cases of hepatitis coming to us. Hepatitis means where the liver enzymes were increased and all. And in that, 55% of them were due to hepatitis A and E, and the rest were due to dengue infection, due to tuberculosis, drugs, etc. So the most common cause of jaundice and in children and viral hepatitis is hepatitis A. Let's first understand how we can prevent it. It is through getting good hygiene, safe water, safe food practices, hand hygiene. These are very important, and the step that the government has taken in ensuring across the country, improving the sanitary conditions and having toilets available in each village and district is a very important step, because improving the sanitary conditions will reduce the incidence of conditions like hepatitis A and The other way we can prevent besides this is the use of hepatitis A vaccine. It is truly alarming that overweight and obesity is rising at an alarming speed in children in India. Where are we going wrong? There are 5 steps that we can take for it. One, we need to understand and that obesity and overweight is a disease in itself, because that predisposes to conditions like metabolic syndrome, insulin resistant, and predisposes to diabetes, hypertension, atherosclerosis, cardiovascular disease, dyslipidemia, joint problems, polycystic ovary, infertility, sleep apnea, and so on. So, number one, we need to realize that it is a disease. Second, an adolescent child has 80% probability of becoming an adolescent adult obese. So, obesity in adolescent age will go on to be obese adults unless they work. So, it is time, if you want to reduce the incidence of the communicable diseases in adults, like we want to reduce cardiovascular diseases, strokes, diabetes, we need to work in children and prevent their overweight and obesity. Number 3, there is a change in our lifestyle which the children are following too. There is over increase in use of processed foods, preservatives, and reduced intakes of vegetable, fruit, plant products. This and aerated drinks which are available are absolutely an extra source of waste energy that we take, and these sugary drinks that we are taking are absolutely destroying our body, not only in terms of obesity, fatty liver, diabetes, heart disease, it also destroys your gut microbiota, and a change in the gut microbiota is going to give rise to change in your behavioral pattern, stress, etc. So, a lack of activity in children and overuse of screen time is very important reason that it is not only, you see, screen time for those who, now in India we have mobiles available, digital is pan across the country, we are digital. So even in the lower socioeconomic status, the screen time in children is getting very high, and their outdoor activities is reducing, and use of processed preserved food is highly increasing, which we all need to look into. Conditions like constipation is a huge rise in children and adults, and that itself can predispose to dysbiosis, destroying your microbiota, overweight, obesity. So that's another important cause of obesity in children. Another important thing I would urge all parents to understand is to maintain a growth chart. It is only through a growth chart which your pediatrician maintains, you will realize that your child is getting overweight or obese, and you will be able to take necessary action. And all of us owe it to our country. We need to ensure that we are going to fight against this epidemic of rising obesity in our country. Work in childhood, adolescent, and that's how you're going to have healthy adults.